begin this half hour with Michigan's plan to roll out a coronavirus vaccine. Thank you for staying with us. I'm Glenda Lewis.
And I'm Alan Campbell, and we've learned healthcare workers will get the first doses of the vaccine once it's available. Joining us now is someone we all know is part of that group, our very own chief health editor, Dr. Partha Nandi. So, Dr. Nandi, how do you feel about being one of the first in line to be vaccinated?
I'm excited. I'll tell you, unlike some people who think that, this is not a panacea, that things will get bad. I'm really confident that we will do well. And I'm really confident that the vaccine will be safe, and that I trust our FDA. I trust everybody who's saying that this scientific community will say that it's safe. So I'm excited about doing that.
Well, that's reassuring to hear, Dr. Nandi. There are different phases when it comes to the vaccine being rolled out. So can you walk us through them?
Absolutely. Now, besides healthcare workers, Glenda, phase one also includes folks who live at work or live or work at long-term care facilities, prisons, and homeless shelters, and those who are at risk for severe complications of COVID-19, like folks who are 65 and older and those with underlying chronic health conditions. And up next is phase two after that. Those include essential workers, right? Those in grocery stores and food distribution places, along with other high-risk populations. And finally, phase three, the vaccine will be made available to the general public.
So, Doc, where would people go to get vaccinated, and what happens if a vaccine requires a second dose?
Alan, the vaccines will be distributed first to hospitals, right? Makes sense. And then to health clinics, medical offices, and then pharmacies. And if a vaccine requires a second shot, the plan is at the moment is for healthcare officials to mail postcards or send text messages as a reminder, because some of these vaccines require a second dose.
So where do the COVID-19 vaccines stand right now, Doc? Can you update us on that?
Absolutely. And Linda, you and I were talking about this offline, right? So both Johnson & Johnson and AstraZeneca, the vaccine trials in the U.S. are on pause, and that's because of unexplained illnesses in participants. To me, that's a good thing. I talked about in the beginning, I trust our FDA. They've said, we need to get more information before continuing. Now, so I'm happy about that. The other two vaccines, I've talked about them before, from Pfizer and Moderna. Pfizer hopes to apply for the FDA's emergency use authorization late November. That's a little bit more than a month, right? And while Moderna is aiming for December, again, not that long from now. But in order for, to apply for emergency use authorization, the vaccine candidates have to wait for a specific number of coronavirus cases to occur so that there's enough data to show that the vaccine is both safe and effective. And this could ultimately affect their timeline. So it's possible that the vaccines could be ready later than what the companies are predicting. But here's the news, right, Glenda and Allen? This is why we're telling folks to do the right thing, because we're going to get a vaccine, get over this, but we need to prevent illnesses in the meantime. And hospitals are increasing with their admissions. People are getting sicker and caseloads are increasing. So let's do the right thing. So when the vaccines come, man, we're ready and to be done and over with this COVID-19.
Yes, Doc. And when you get it, if you're comfortable with it, we want to walk through this with you. Okay.
100%.
Okay.
Oh yeah, absolutely. Because I want to let people know what it feels like. I think it's going to be great. This is a testament to our effective scientific community working together, and I'm really confident about that.
All right, Dr. Nandi, thank you as always.
My pleasure.